They share everything, even the same rare condition. Diagnosed as children, but local twins just got a chance at normalcy. News 5's Nadine Abusala spoke with the men and the pediatric surgeon who offered them a groundbreaking surgery.
Gabe and Drew Worley are twins who share more than their looks.
Did it help to have your brother in this journey with you?
Yeah, I don't know where I would be without Gabe.
It all started for Gabe on the playground years ago.
I passed out and had a seizure.
Gabe was taken to the Akron Children's Hospital where he had another seizure.
They know my heart has stopped, and so I was diagnosed with sinus node dysfunction.
So Gabe had a pacemaker put in, and as he was recovering from surgery, Drew all of a sudden passes out, showing the same signs as Gabe.
Nurses came in, they were rushing, and that's when my parents knew that this could be a serious problem.
Dr. John Clark with the Akron Children's Hospital says it's rare for a 6-year-old to have sinus node dysfunction, and in twins, it's unheard of.
That is exceptionally rare. They are the only set of twins that I have who have sinus node dysfunction.
The sinus node is the heart's pacemaker. At times, it can send the wrong signal, causing patients to pass out or get dizzy. When Drew and Gabe were diagnosed, there was only one treatment, a pacemaker.
If the sinus node shuts off, if it's not doing what it's doing, then the pacemaker will kick in and tell the heart to beat for them.
So at 6 years old, they received those pacemakers.
We obviously couldn't play contact sports. We had to get homeschooled for a few years after the surgeries.
By college, they had adjusted. Then Dr. Clark called with a new procedure that could change things.
We were amazed at this new technology, but also we were faced with a little hesitancy.
The surgery had never been done in the state. It would affect the vagus nerve in the brain, which sends signals to the heart to slow down, or in patients with sinus node dysfunction, to stop.
Where that nerve enters the heart is at very defined points in the heart. So in the cath lab, we can find those points where that nerve enters the heart, and we can cauterize that area. And that modifies the heart's response to that nerve.
The best part is if it's successful, over time, pacemakers would no longer be needed.
How does that sound when I say that? Your pacemaker is going to be removed.
It's mind-blowing because we've known pacemaker our whole life. We've had a pacemaker and we don't know anything other than a pacemaker, so it's hard to fathom.
And patients like the Worleys could live a normal life. Nadine Abusada, News 5.